New videos every day.
Hi, I'm Dr. Vincent Bellonzi. I get questions all the time about what a chiropractic is and what a chiropractor does. So I thought I'd address that. A lot of people think about physical therapists, they think about medical doctors, they think about doctors of osteopathy, and then they try to figure out where chiropractors fit in this mix. Depends on the state, and the states vary a little bit in what doctors are allowed to do. I'm here in Texas, so in Texas, there's quite a bit that chiropractors can do. And in the past, they even used to do a couple things that were possibly will get back as far as IVs and such. But right now, as far as chiropractic in Texas, chiropractors do a lot of what physical therapists do. We learn a lot of the same things as far as using different therapies and how to rehabilitate the body so it can work better. There are some chiropractors that do a better job, and there are some chiropractors who simply adjust. There are some physical therapists that just put hot packs on people, and there are some physical therapists that I have a lot of respect for because they really know how to do functional exercise and get somebody to a point where they have restored their ability to live life again. So, you're going to find in any profession people that are better at what they do and people that do a little bit less. So when we talk about chiropractors do physical therapies. We apply many of the same things that a physical therapist do as far as using passive modalities, things like muscle stim that you hear about, sometimes heat, different machines to help the body to either heal or to balance things out. But there's also a facet of physical therapy that's rehabilitation. And both chiropractors and physical therapists learn this and are responsible to do it. And some do it better than others. In my office, we do quite a bit of rehabilitative therapy. And what it boils down to is getting somebody strong and stable so that they can do life, so that they can function in life. And that's really what physical therapy is ultimately trying to accomplish. And so the same with chiropractic. So again, depending on the state, but in most states, chiropractors do offer physical therapy. And I work with physical therapists. There are times when I will refer and prescribe physical therapy, which I can do legally and I'm required to do if I need to. So I work with physical therapists. I do physical therapy in my office. I do rehab. I also happen to be a running coach and I do quite a bit with athletes. So I do some testing and rehab on them as well. So physical therapy is an important and integral part of chiropractic. It helps the basic thing, which is the adjustment to hold and to be more effective. You have to, in a sense, look at everything as far as function physically if you're going to practice either chiropractic or physical therapy. There are physical therapists that do some manipulation, and there are some that do it very well, and there are others that probably should take more training. But chiropractors are primarily taught to do some kind of adjustment, and the reason is to mobilize the joints to help improve function. And there is some science behind this. There's some very good studies done, and there are some peer-reviewed journals, some very important journals that use manipulative therapy. But chiropractors are really trying to improve function, and so are physical therapists. So however they go about it, they both are licensed to do so. They both learn how to do it in school, and they both do continuing education to try to get better and better at what they do. I'm also a personal trainer, so I incorporate some of that as well. And there are some personal trainers out there that do a fantastic job at helping people restore function. In fact, a lot of times I think that I can get someone so far, and then I can turn them over to a personal trainer, and they can get to an even higher level. So that's true for a physical therapist as well. As I mentioned, chiropractors rely a lot on adjusting, and the adjustment is really something that improves function. You're removing interference. It helps to get rid of pain, but actually on another level, it helps to get the nervous system to operate better. If there's interference in any way to the nervous system, whether it's a high intake of sugar or the fact that you need an adjustment, you're going to have a decrease in function and you're going to have some problems. So whether you go to a physical therapist or a chiropractor, you're going to get exercises. You're going to be taught how to do things better. A very basic thing that most people don't do or lose the ability to do is practice their balance. And I know some very good physical therapists who start with that. And I know some good chiropractors that work with balance and work up from there. And it's funny how people get this idea that they should stop doing something if they have an injury. And I actually have a little problem sometimes with orthopedic surgeons and some of the specialists that actually should know better, because the idea that you have a back injury and then you don't lift anything, or you have a knee injury and then you stop doing things because you might hurt the knee, that just makes the whole situation worse. So a good physical therapist, a good physiatrist, which is an MD that has training in physical therapy, or a chiropractor understands the fact that you need to restore function, and that's going to take some work. It takes rehabilitative exercise. You need to strengthen joints, you need to stabilize the joints, but they need to maintain their function. And that's the only way that you're going to improve, and that's the only way you're going to stop degeneration. So again, as far as differences, different schools, but learning pretty much the same concepts. So chiropractors do physical therapy. They are licensed to do so. They are required to know how to do it. It's something that they learn hopefully very well. The same with physical therapists. Chiropractors also have the ability to diagnose and prescribe, which is something that I think the physical therapist should have, and they're getting very close to. But right now, a physical therapist has to wait for a referral. But chiropractors can do a lot more, especially in certain states. In Texas, again, chiropractors do a lot of lab work. Not every chiropractor, but it is within the scope of practice of a chiropractor to use lab work to diagnose and prescribe certain things. Now, many things that a chiropractor will prescribe can come down to food supplements or nutrients. So nutritional supplements are used, herbs are used, even perhaps some homeopathic type remedies. Depending on the chiropractor, he or she may uncover things that will be referred to a medical doctor. I happen to work with a couple medical doctors, which allows me to do things I might not be able to do on my own. My limitation is only that I cannot prescribe things that are controlled substances or things that are injected into the body. So I can prescribe certain things, but what I'm really trying to do when I evaluate lab work is see if the biochemistry is working right. And I have every bit as much education at doing that as medical doctors do. And I have the responsibility to evaluate every piece of lab work that I order, whether it's something as simple as a blood count or a blood sugar level or a metabolic panel, or something as complicated as perhaps even genomic testing or some of the other nutritional biochemistry tests that can be done. So chiropractors are qualified and do many of these things. In many cases, you'll find that the chiropractor, after evaluating lab work, will try strategies that don't include right off the bat getting into drug therapy. And if you go to the medical doctor, on the other hand, you'll find that the first step is usually drug therapy. Hopefully, the medical doctors that are out there will talk to you about nutrition and exercise and the other things that you can do without going to drug. And there are some good medical doctors out there that do that. But chiropractors have in their scope of practice the ability to do many of the same things as medical doctors do, many of the same things that physical therapists do. And there are some extremely good chiropractors out there that do an excellent job and are very qualified. There are some very good MDs, PTs. There are good therapists of many licenses. And you've got also osteopathic doctors. These are all good practitioners. And again, you'll find that the ones that have done something beyond their schooling are usually the better practitioners, the one you'll get more out of. But chiropractors don't just adjust. And chiropractors do more than just alleviate pain. They're good at that. They can adjust the spine, they can adjust other joints, and it can be a very effective way to not only alleviate pain, but to restore function. And that's all we're trying to do. Whoever you talk about, whatever practitioner, the whole idea is to somehow get that person functional again. So if you had a little bit of misunderstanding about what chiropractors do, I hope that helps. Again, chiropractors are licensed to do a lot of things, and I enjoy doing them. And I like interacting with other professionals, and if you can get somebody who can work together with other professionals and get some different points of view, I think you'll get a little better treatment than just simply going to one person and hopefully not getting too reliant on one thing. Again, chiropractors, there are good ones and bad ones. Physical therapists, there are good ones and bad ones. Medical doctors, osteopaths, there's some really good ones, and there's some that I wouldn't send anybody to. So it's true in any profession. But chiropractors are fully licensed to do the things that they do. So if you have any other questions, feel free to contact me. Just wanted to talk a little bit about chiropractic. It's just one more way to get interference out of the way so your body can work better, so you can be all you can be. Be happy, be healthy. This is Dr. Vince Bellonzi.
For more great videos like this one, check out the Psychetruth channel on YouTube.
Woo!